give away Mom and Cat and Lily.
31.1 kilos.
I'm
Not sure what that is in pounds, but we'll figure it out.
So when he was racing, he was 65
He
pounds.
raced at 65 pounds, yeah. And he raced back in 2006 to 2009 in Massachusetts at the Wonderland and the Raynham tracks there. And he was a pretty good racer, actually. He went up to grade A racing pretty quick. He won a lot of races, and then he eventually graded off when he was about 4. So he raced about 4 years, graded off, and went into a home where he stayed until his previous owner was having some health issues. He was an older gentleman and couldn't keep care of Brave anymore. So he was returned to the program, and he's here today to get a dental. And you can see his teeth before. That's a good boy. See the tartar on the back tooth there and everything, and on the front canine.
Yeah.
Yeah.
And how old is he now?
He will be 10 years old, April 13th.
Okay.
And then this side over here, lots of tartar buildup. His gums are swelled up there.
Wow.
So we'll talk to the vet and we'll see what the vet thinks.
Yeah, this is stage 3 dental disease, right? I mean, it's got periodontal disease and furcation, and some of those teeth are probably lost already. Pretty tough though. So yeah, we'll assess everything under anesthesia with x-rays and clean them up and do what has to be done.
Take care of dogs' teeth and how we can take care of them and that sort of thing.
Well, in an ideal world, we'd like not to see these. And again, in your situation, it's nobody's fault, but the way they're presented to you. We talk to people at 8 weeks of age about dentistry because most dogs and cats, the great majority, will have dental problems in their lives and gum disease. So we like the people to be aware of it so that they're cued into this. To brush their teeth, to give them dental toys, chews, diets that will help that. So there's a lot of things that owners can do at home. There's solutions you can get, and certain breeds are worse than others. But most dogs, in my experience, almost 40 years now, don't need to have extractions. They're extracted because the treatment is delayed. That's the problem. And dogs do not get cavities. They can, but it's very rare. They get periodontal disease from plaque and tartar. So first of all, you've got the plaque, which is the scummy bacteria, protein thing, film every day when they eat. Calcium attaches to that, and that becomes tartar, and then the whole cycle starts again. More plaque, more calcium, more tartar. So it gets like rings of a tree, you know, that grows, and then it starts to grow underneath the gums, and that's when you get pathology. I tell people this, if it didn't touch the gums, would just be ugly and stinky. It probably wouldn't cause any health problems. As soon as the gums are affected, those bacteria and toxins are absorbed in the body, in the bloodstream. You can get cardiac endocarditis, that's severe. Kidney problems, obviously you've got a source of infection that's bothering them all the time. And if we don't talk about that, let alone the pain and discomfort. This is painful, this is discomfort, and unfortunately, I call it silent pain, but for the dog it's the same pain. The silent's not there. It's not silent to them, it's silent to us, because they don't complain. And they won't necessarily whimper, they won't necessarily cry. Some of them will rub their face on the floor and eat on one side of the mouth sometimes. Sometimes you'll see they go to food and they'll jump there, they're hungry, but they're reluctant, it hurts a bit, so they're kind of a little shy about going right to their food and eating, especially dry food. But the unfortunate thing is that a lot can be prevented.
And that's a really good point, that a lot of owners that we deal with, they don't realize the pain their dog is in because they're not necessarily shaking or panting or whining.
But it's still pain.
But it's still a lot of pain, and they shouldn't have to live like that.
No.
Yeah, for sure.
So it is things that we always talk about prevention. It's not as exciting, but it is a lot better for the pet.
Yeah,
It's a little boring to talk about prevention. It's less expensive, less painful. They live longer and they keep their teeth.
Yes.
Because there's not a lot of reasons. Like they break carnasials sometimes that have to be removed, or they break a tooth or a car accident. Yeah, I understand that. But for wear and tear, we shouldn't have to remove too many teeth in dogs. Cats are different because of Lyme disease, but in dogs, they should have a lifelong set of teeth that work and are functional.
Now, just briefly mention about the bad breath, because a lot of people just think it's normal for a dog to have bad breath, and they don't understand that maybe there could be an issue with their teeth.
It certainly is. I mean, bad breath is usually as a result of infection of the gums. It's usually what it is, and here it's really bad. You know, I come in an exam room and the owners are there with the dog, and you know, it hits me right away, and I can't understand how at home you probably want to think about that, even if you didn't. You know, you'd want to think about, there's an odor there, that's not normal.
We notice it just in the car driving here.
Oh yeah, a small place, you notice that, and you pick it up. So yeah, bad breath, halitosis is not normal. Most of the time it's because of gum problems. Some of the time it's a medical issue. Diabetes, kidney failure can have a bad breath, yes.
It would be a different sort of breath.
Yeah, different. Yeah, diabetes is a sickening sweet breath, and the uremic breath is kind of unique, sort of sickening breath that you smell with these sick animals. Yeah. But most of the time, if you get rid of a teeth problem, you'd have a lot of bad breath issues. And there are a lot of good products now that when they chew on it, it liberates you know, things that dissolve this plaque, and it helps the pH of the mouth, disinfects it.
Anything in particular you'd recommend, or?
We have, there's the pet stores have them, we have them here. There's a lot of research been done into that. Dental diet is excellent. Some of the chews are just excellent because they liberate things that kind of dissolve the plaque and disinfect the mouth. And dogs love it anyway too.
So they can talk to their veterinarian and...
Absolutely, and so owners should have a discussion with their veterinarians about dental, namely to try to prevent it. Once they get the problem, what the treatment should be, what you should do going forward to prevent further issues, or delay them at least. Yeah,
and if they do need a dental, get that done, and then follow up with preventative after that, and they should probably not...
And some dogs, you know, like we don't see them until they're 7 or 8 years of age, they've never had dentistry done, and their teeth are pretty good, but they need a dental. And we've got to realize the other thing too, that a year for a dog is 5 to 7 for a human. So would we go without brushing your teeth or flossing, go to the dentist for I don't think so. If you do, you're not going to have a big social crowd. So 1 year, things, all the pathology in dogs goes a lot faster. So we got to realize that. So when there's a problem, you don't neglect it too long, because it's going to speed right up and give us stuff that like this. Right. How old?
He's going to be 10 in April.
Oh well.
Yeah.
How long have you had him?
In foster care, we've had him a couple weeks now. We wanted to get his stomach back into good shape there, and
pretty good body condition.
His coat's still shedding a lot, but we gave him a bath.
He looks like a well-adjusted individual.
Yeah, he's a pretty cool guy.
Jacqueline. I'm registered veterinary technician.
And you're going to be doing Braves Dental today. Awesome.
So furcation is when you can put a probe in between the roots. You shouldn't be able to do that. So that's the one that we removed. There's a root that's broken inside there. See that? That tooth doesn't even show on the outside. It's not giving any problem. It looks like it's been reabsorbed by the body.
Does it look like it was from a dental before, or just?
It could have been just broken. Probably wasn't even a dental.
A long time ago.
Yep.
Yeah.
And those are the two that are moved in the back.